what do you know about what I'm interested in is the vitamin C injection seems to cure a lot of diseases like cancer, leukemia, and flu and stuff. I'm just wondering, what do you know? Have you had any experience with that?
Well, there's a great deal written about the benefits of vitamin C. Sudden infant death syndrome was epidemic in the Aborigines in Australia, and Dr. Calikernos, in fact, he wrote a book, Every Second Child, a fascinating book. But he wrote that vitamin C would eliminate that epidemic in that particular population group. There was just recently another case of, I can't think, it was acute swine flu. An individual in Australia was hospitalized and considered terminal, and the traditional medicines they were administering in the hospital were not working. His family had learned about vitamin C, and they asked the hospital to do that. The hospital refused. They hired a lawyer. The lawyer had apparently a little more influence on the hospital administration, and so they finally started administering vitamin C. Initially, they just gave small doses, but then they worked up their courage and started giving him 50 or 75,000 milligrams intravenously a day. And within a few weeks, he went home from the hospital. An amazing recovery story. There's a book. I wish I could quote the title, but I won't. If people want more information about that, they should go to the vitamincfoundation.org website, and you can learn about all these things, the many things. But the book I'm thinking of has chapters in there about the use of vitamin C in the treatment of measles and Rocky Mountain spotted fever and actually rabies. There's a Dr. Klenner on the East Coast, I think it was one of the Carolinas, when there was a polio epidemic. He was treating all his polio cases with injectable vitamin C, and most of them got well. It's an amazing molecule, and interestingly, I have some grandchildren, and they, about 8 months ago, I have a daughter. She had a 2-year-old, and he was just struggling with this chronic, I don't feel good, tummy ache, headache, poor appetite, just wasn't doing well. Her pediatrician had tried various things and didn't seem to make much difference. And after 2 or 3 months, it was, she called me, asked me what I'd suggest, and with that book fresh in my mind, I suggested she consider giving him vitamin C injections. Well, it's a sort of a painful injection. But she gave it to him one night. I think she only gave him about 500 milligrams, but she gave it in the muscle. And the next day, the child was essentially well. But then about 12, 14 hours later, he seemed to be slipping a little bit, and the 2-year-old, 3-year-old, whatever, I can't remember, but he went up to his mom, and despite the fact that the shot had been very painful, producing tears, and the child actually said to his mother, I think I need another shot of vitamin C. It's amazing stuff. But like Linus Pauling says, I think he coined the term orthomolecular. He said, you have to use the right molecule at the right time, but in the right quantity. And that's where many of the studies in vitamin C have failed to be reproduced, because the doses they use are much, much smaller than have been recommended. But so we see that almost any viral disease will respond to vitamin C if you give it in large enough quantities. Vitamin C is a very good detoxifier because it stimulates the enzyme system in the liver that does the detoxifying of environmental chemicals also. And the book, Dr. Levy is the author's name. So go to the Vitamin C Foundation website and look under Dr. Levy, Thomas Levy maybe, and you'll find his book. It's a fascinating book. Unfortunately, it's difficult to get or find a doctor that's willing to give you injectable vitamin C. And so oftentimes we are stuck with going to the doctor occasionally for an IV of vitamin C, but that's expensive and time consuming, and in the state of Oregon, there's out of 10,000 doctors, there might be a dozen that'd be willing to give you vitamin C intravenously or in the muscle. So it's unfortunately, I've gradually, after 30 years, almost 40 years of practicing, most chronic illness is malnutrition. whether we're talking about cancer or diabetes or arthritis or heart disease. And we just aren't getting the vitamins and minerals we need to prevent these conditions from coming on. And then we get the lay press saying, all you need is to eat a well-balanced diet. Unfortunately, no one will define what a well-balanced diet is, and the nutritionists and the doctors are trying. I don't mean to denigrate their efforts. Most doctors are trying, but they get in the system. If a doctor works in a clinic, before he can change what he does, he has to get the approval of all the other doctors in the clinic. So it's not very conducive to innovative type medicine. I had a phone call a year or two ago from a doctor that worked for Kaiser. And he said, I'm very suspicious that this patient has a magnesium deficiency, but we don't order red blood cell magnesium in Kaiser, and so I can't measure her levels, and I can't give her magnesium therapy unless I can measure it first. And so here was a case where magnesium would probably have helped this individual, but the doctor was handicapped because of the environment he worked in. It's a fascinating study I came across, and when I was cleaning out one of my files, it was a study done in South Africa, published in the South African Medical Journal. This is back in the 50s or 60s. These doctors said, let's find out what magnesium will do for heart attack patients. And so what they did, every person that came into the emergency room, they had the symptoms and electrocardiographic changes of a heart attack, were giving injections of magnesium sulfate. Every 6 or 8 hours, they got a shot of magnesium. And 90+% of the people were, quote, cured. They went home asymptomatic with a normal electrocardiogram, just with magnesium sulfate. And so if just say, for example, we took a hypothetical case where we treated everybody in the emergency room with magnesium sulfate, the cost of that would probably be, I suppose with the personnel and everything, $200. If you go to the hospital these days with chest pain or symptoms of a heart attack, your bill will probably be closer to $10,000. And so because of the legal environment we live in, if you have a heart attack and the doctor just gives you a magnesium shot, someone's going to sue you. So doctors will not do that. And so it's a real catch-22. We could save all sorts of money, we can save all sorts of lives and morbidity if we were free to give people the choice. What would happen if you went to the emergency room and you think you're having a heart attack and the doctor said, I'll give you a choice. You can have an angiogram and maybe bypass surgery, or we'll give you a magnesium shot. So it'd be a very interesting study, but it'll never be done just because of the environment we've created for ourselves with high tech and lots of lawyers and things of that nature. So we have a real difficulty in this, our country here, because everybody expects the best care and the study with the most technology, and even though the individual may not have to pay for it, they expect it. It's considered a right. We have a right in this, the theoretical right is we've been told we have a right to medical care in this country, and not only without paying for it, but we want the best. We don't want any. So it's a real tough situation. But because of the treatment that there's, like I mentioned earlier, there've been several doctors in this state that have been. I first came to work here in 1979, and I came to work with a doctor that's into doing more alternative types of things. But shortly after I got here, he was forced to leave the state because the medical board said we're either going to take your license away or you have to leave. Well, so he left. He had an opportunity to go to a different state. And so, and over the years, doctors have been disciplined for doing things that are different. Just when my license was revoked the first time in 1993, another doctor that was doing alternative type of care had just been disciplined so severely that he could not practice in this state. He had to practice under the direct supervision of another doctor. The the disciplinary measure. He hadn't hurt anybody. His patients were complaining. In fact, in the final order from the medical board, it said repeatedly how much his patients liked him and how much they realized he cared for them and how much he was helping them. But because he was using things like a substance called cudopressin, which is a liver stimulant, and he was using muscle testing, and he was doing vitamins and minerals, he was just disciplined. And in my case, it's somewhat similar. I had one patient complaint because I hurt her feelings. No physical harm, and the only other complaint was a former director of the Board of Medical Examiners, chairman of the Board of Medical Examiners, complained that I was using testosterone. Well, the current medical literature on testosterone indicates that what I was doing was in line with what was recently published in the New England Journal of Medicine. But still, here I am, suspended from practicing medicine for 3 months at least, because I was following the guidelines from the major medical journal in this country. So it's frustrating, and it's a real, I feel a little bit like a Dr. Semmelweis, an Austrian doctor back in the 1800s, who was actually removed from the hospital staff and forced to leave the country because he suggested doctors wash their hands. Now, it isn't quite as bad, maybe, but it's similar. Like the young lady I talked about earlier. I'm almost positive that if someone had suggested she used thyroid 5 years ago, she wouldn't have had 3 invasive medical procedures. She wouldn't be on several different drugs and still struggling with her bowel problems and still not better. That's very frustrating. And I feel bad for this young lady because unless she changes something about her approach to her condition, in 5 years she'll be having hysterectomies and breast biopsies. And another interesting sidelight from this is that this is sort of like on the internet. You Google a topic and you go to one topic and then you see something else that reminds you of something. Then pretty soon you're down. You got 4 or 5 sites open and you can't remember where you started. But I hope that maybe answered that question you had about vitamin C. We got on to, I was just going to talk about iodine. There's been a very interesting book written about the relationship between breast cancer and iodine. A very definite relationship between breast cancer and iodine also ties into the need for thyroid, the thyroid deficiency we see so often, because iodine deficiency is a major cause of hormone resistance. And if you don't have enough iodine, you can't make enough thyroid hormone, and then classically that was a goiter where you get a big swelling in your neck. But a more subtle reason for this is that you have enough iodine to make the hormone, but the little receptor sites on the cell membrane, which allow the hormone to get into the cell, does not have enough iodine, or it's been replaced with chloride and bromide, or chloride, bromide, and fluoride, which are very similar physically to iodine, and they replace it on the cell membrane, and so the iodine doesn't work. A very interesting study was done in which a subject was first they measured the amount of fluoride, bromide, and chloride this person was excreting in their urine, and then they gave them a small dose, but it was a small dose in the alternative world, but it was actually about 100 times more than the recommended daily allowance. But they found that when they gave them a little bit of iodine, they started increasing their urinary output of fluoride, chloride, and bromide. And as they increased it even more, they could actually raise the amount of fluoride excreted by over 100 times. And there's nothing else that I'm aware of that will do that for people. And it's safe and it's inexpensive. And so we see that sort of thing. The recommended daily allowance is basically the amount a person can take to avoid the over deficiency disease. For example, in the case of vitamin C, well, they learned at least a couple hundred years ago that if people in the British Navy ate a lime a day or something like that, their teeth wouldn't fall out and they wouldn't die. It used to be the mortality rate of sailors when they go around the world was almost 50%. And the majority of those were dying of scurvy. Well, scurvy is a breakdown of the connective tissues of your body so that your teeth become loose and you bruise more easily because your blood vessels are very fragile. Well, they found that if you took 60 milligrams of vitamin C a day, you won't get scurvy. So unfortunately, the scientists in our day and age say this is all you need. Well, that's because they didn't understand the potential for adequate amounts of vitamin C. And now Linus Pauling and Matthias Rath and a few other really geniuses have come along and said, no, if you take 10,000 milligrams of vitamin C, you probably won't get cancer. And you probably won't get heart disease, because vitamin C is critical for the maintenance of a healthy lining of your blood vessel. And if the lining's healthy, then it won't break down and you won't get little plaques inside there that eventually cause the heart attacks and the strokes. And so we see, and the same way with vitamin D. For years it was, if you take 100 or 200 units of vitamin D a day, you won't get rickets. Well, that's right. But rickets is just the tip of the iceberg. And just like vitamin C and scurvy, now they're saying you can probably take 10,000 units of vitamin D safely. And just one recent study in the Journal of Epidemiology, you can reduce your risk of breast cancer, colon cancer, and prostate cancer by almost 75% if your blood level for vitamin D is 60. See, and that isn't published. It is, but you don't see it in the mainstream media. Now, I'm going to, run the risk of offending a few people, but I think part of the reason is we don't make much money if you don't get colon cancer. Now, I have a friend that just had colon cancer, and he went through radiation and chemotherapy and surgery. And I don't know specifically, but it wouldn't surprise me if he or his insurance company or you and I through the Medicare system paid $100,000 or $200,000 for his care, when the cost of vitamin D is 25 cents a day. So it's a real difficult situation. Each year in this community, I can't say that for sure, but almost every year there is a public relations article. I don't really call it a news article, because most of the time organizations get an article put in the newspaper, which is really a subtle way of advertising for themselves. But it is one of the local clinics that does colonoscopy, and this is the big push, is prevent colon cancer by getting a colonoscopy. Well, that doesn't prevent it. It might catch it early, but it doesn't prevent colon cancer, even if you remove a polyp. The polyp is a symptom of something is wrong in the intestine. Well, for 2 or 3 years, I tried to get a letter to the editor published that said, gee, getting your colonoscopy is great and everything, but why don't we push vitamin D? Because we can prevent it, not just catch it early. Well, after the third attempt, they finally published my letter to the editor. And so, but if we eliminate the colon cancer surgery and the bypass surgery with vitamin C, and it won't eliminate it all, but it will significantly reduce the incidence of it. The hospitals would probably have to close a major portion of their facility. And so and since I don't advertise very much locally, I'm not a big customer for the local news media, but whereas the hospitals advertise on a pretty regular basis. It's the same way with breast cancer. They say, get your mammogram and you will catch breast cancer early. That's not prevention. The most reliable way, the most effective way to eliminate breast cancer is to not have an abortion. First, when women get pregnant with their first baby or and it is aborted, the risk of breast cancer goes up 10 times. Now, that's not my figure. That's the Breast Cancer Institute, which is dedicated solely to preventing breast cancer, has published those figures. Unfortunately, we put so many women that have menstrual irregularities and probably need thyroid and iodine, we put them on some form of oral contraceptive, and the World Health Organization has labeled the ingredients in these oral contraceptives as a class 1 carcinogen, which is right there in the class with asbestos and cigarette tars. So it's a real, it's a confusing world, because there's all these various voices clamoring for our attention, but people need to educate themselves, and they need to go to websites like Mercola and the Vitamin C Foundation and the Vitamin D Council. People are interested, they could send a SASE to my office, and I'll give them a list of some of these websites, because you've got to educate yourself. You're not going to get this information from most doctors' offices. There are naturopaths out there, and some, unfortunately, not unfortunately, but chiropractors are probably more interested in your nutritional status than most of the medical doctors. It's interesting that a recent appearance before the investigative committee of the medical board, I was introduced to a lady who called herself an integrative specialist. And the medical schools are developing what they call integrative medicine, and they are indicating that they want to integrate with the chiropractors, they want to integrate with the naturopaths. And I've talked to people at the naturopathic school and chiropractors who indicate that what that really means is the medical school is coming to their schools and encouraging them to learn more pharmacology so that they can write prescriptions. And so what it really is a sort of a takeover, I feel. I don't think the medical school is into coffee enemas or castor oil packs or prototherapy or cranial sacral therapy. But it's the medical school is interested in getting the osteopaths and the chiropractors and the naturopaths into writing more prescriptions. I have a son in osteopathic school, and he went to osteopathic school because he likes the idea of manipulation. And he had a good experience with the local doctor here that does manipulation, and he's actually labeled an orthopedic medicine doctor instead of an orthopedic surgeon. But he went to osteopathic school because he was interested in more hands-on type therapy. But he tells me that basically what he's learning is medical school, much more time spent in pharmacology than there is in manipulative type techniques. And so this idea of integration seems to be a little bit of a one-way street. And so if people would educate themselves, they have to go out there and find what's available, and then they have to try and find someone that would be willing to help them with it. Unfortunately, the thyroid issue is huge. Because if you just go to Borders or go online and go to Amazon and Google in thyroid books, you'll find that there's probably 10 or 12 books written by doctors and lay people addressing the issue I spoke of earlier. Blood tests are normal. There's a fascinating book on fibromyalgia written by a Dr. Lowe. It's amazing work, and there's a whole 20-page chapter written on thyroid hormone resistance, and the chapter must have 300 references from the peer-reviewed medical literature. It's an amazing chapter, a real eye-opener, but unfortunately, because of this addiction, I think it's the best way, to the blood tests, it's very difficult to find a doctor who's willing or courageous enough to prescribe thyroid medication in the face of normal blood tests. Hopefully that can be changed, but it won't be in the immediate future. There are places online. We have some patients who find that they go online, they have to get thyroid from Mexico or Thailand or because they just can't get it locally. So it's a matter of educating yourself, and for some people, if they get rid of some of the chemicals in their environment, they're taking some iodine, they're taking the trace minerals that the hormones need to be converted into the active hormones, and just taking better care of themselves. Regular exercise, get off the sugars, things like that. It'll make a huge difference. Adequate amounts of vitamin D and C.
So many things. I notice nowadays, though, doctors, regular medical doctors, are actually just working for the drug companies. It seems like, it's about making money. I know my wife had, that whatever you call it in your wrist where you
carpal tunnel.
Yeah, carpal tunnel, and in both wrists, real bad, and she just took MSM and vitamin C, and her wrists are okay after that. And we told the doctor she was seeing then about it, And the doctor lady said, well, I'm not going to tell anybody about that. You're supposed to get pain medication and then get operated on to fix that.
Speaking of carpal tunnel, there's a variety of things like that we hear about, but here it's a dilemma. You know, the doctors aren't working for the drug company, and the vast majority of doctors are trying to do a good job, but they get into a dilemma. You work in a clinic and you're expected to see so many patients a day. And so you're limited in the amount of time you can use. And like I said earlier, in a clinic, if you went in with carpal tunnel and I'm the doctor and I say, well, just put MSM and vitamin C on it. And
no, you eat the MSM and vitamin C.
Well, but MSM. Oh, okay, that's fine. Whatever. MSM is such a wonderful substance. You can do it that way. You can drink it. You can rub it on. You can we do it intravenously. You can do it as enemas. It's sort of like DMSO. It's one of an interesting conversation called Dr. Stanley Jacobs in Portland. He must be close to 90 now, and he was a professor of surgery at the medical school in Portland when I was there. He's a fascinating guy. He's such a kind, gentle, generous person. If you call him with a particular problem, he'll talk to you about it. I mean, but that's a good example, and that brings up another experience I had. A friend of mine had carpal tunnel in both wrists, and she was scheduled for surgery. And I said, well, there's maybe some alternatives that you might want to try. I hadn't heard of taking MSM, and that works great. Someone once said, if it works, it's scientific, not the other way around. Some people think if it's scientific, we think it's scientific, it's going to work, but we all know that's not the case. But this lady said, okay, what have you got to offer? Well, prolotherapy is a technique where you just inject a little sugar water and a local anesthetic into that area where the carpal tunnel is. And 80-90% of the time that fixes it. Sometimes it's immediate. I told her about it, and her first comment was, well, will my insurance pay for it? Well, unfortunately not. And it would have cost her $200 to have those two wrists done. Well, she chose to do the surgery. Unfortunately, the doctor cut the nerve on both of her wrists when he did it. So she was in splints for 6 weeks while that healed. And then she went back in and had surgery to repair the nerve, and she's maybe 50% better. So she's had 4 surgical procedures, which probably cost somebody $40,000, $50,000, $60,000 because the insurance company wasn't, and she didn't have she would rather have the surgery because that's what her doctor said she should have. And the doctor was ignorant. The doctor was ignorant as to the alternative. Now, theoretically, when you go to have a procedure done, the doctor is supposed to do what they call PARQ. Excuse me. They're supposed to explain the procedure. And then they're supposed to explain to you what the alternatives are. Yeah. And then they're supposed to explain to you the risks. And then they're supposed to answer your questions. Now, theoretically, doctors aren't supposed to do a procedure unless they've gone through that procedure. Well, obviously, he didn't know about PARQ, or he didn't know about very many alternatives. The alternatives in his mind were probably, well, you can have the surgery, or we can give you pain medication, or you can put a splint on there and not use your wrist. Those aren't very good choices. But see, he should have said, well, I've heard that maybe vitamin C and MSM might work. Or he should have said, let's call somebody and get another opinion. See? But unfortunately, he only had 10 minutes to see this lady, so he didn't have time to do all that. But that goes on and on and on. It isn't just carpal tunnel. It's, for example, herniated disc. If you get a herniated disc in your back, or the usual procedure, there's physical therapy, and there's chiropractic, and there's steroid injections, and there's a variety of other things that are out there. But there's a little known treatment called colchicine, where you can actually shrink the herniated disc with the use of colchicine. And I've got personal experience with that because I had a herniated disc in my neck 17 years ago. And the doctors, I went through the usual, the neurologist and the referral to the surgeon, and had the MRI, so I know I had it. And I couldn't use my left arm. But fortunately, I'd heard about colchicine, and there's a doctor in Las Vegas that has treated several thousand people successfully with colchicine. So I called him and talked with him and read the literature, and so I chose to use colchicine. And now, 17 years later, The only residual I have from that episode is the tip of my index finger on the left hand is a little bit fuzzy. It isn't quite a normal sensation, but everything else is well. There's no pain. I've regained 90% of the function of my left arm, and I'm very happy with that. And so, but it isn't unusual for that sort of thing to be available for almost every condition out there. And so, the feeling of the doctors that practice this way is that we're not going to force people. We aren't going to say to someone who has a particular condition, you have to treat it our way. But that's what traditional doctors are doing.
That's right.
There was an interesting article in the Journal of the American Medical Association a few years ago. Deaths from doctors. The third leading cause of death in this country is going to doctors. And that doesn't speak very well.
That's right.
Interestingly, there's surgical mistakes and there's medication mistakes, but there were, at that time, there were over 100,000 deaths per year from non-air medications. In other words, the medication was given according to the package insert, but yet the patient died. Now, that's a little bit frightening, especially when you see people come to the office that are taking 5, 6, 7, 8 medications. People have no idea. There's no way to anticipate what may happen because of drug interactions. Send a self-addressed stamped envelope to my office. We'll give you the websites that you need to get to. My website we're developing is drdrgambee.com. We're going to try and update it regularly about my relationship with the medical board and also continue to give you tips about what you can do to take better care of yourself. We started our newsletter, I think it's 25 years ago. It's kind of interesting reading them because a lot of times you go back to the old issue and learn a whole lot of new stuff. Anyway, go to the website, send a letter envelope to my office, and I'll give you a list of websites that I think are very, very helpful, enable you to take better care of yourself. We have a saying we like to use: if you don't take care of yourself, where are you going to live? And that your health is too important to leave in the hands of your doctor.